Now let's discuss hypertension, the most common disease on earth. 1 in every 3 persons per the WHO will develop hypertension. Hypertension could be secondary to some endocrine disorder or secondary to some use of certain medications, but here I'm talking about primary hypertension, essential hypertension. What's the cause of essential hypertension? Well, we do not accurately know. We do not very accurately know. Let's take this 45-year-old man presents to the office for advice about diarrhea prophylaxis prior to going on a trip. He is found to have a blood pressure of 145/95. So he's coming for some other indication, but you measured his blood pressure, it is 145/95. What are you going to do? Are you going to start treating him with diuretics? Are you going to advise low salt intake? Are you going to advise nifedipine, calcium channel blocker? Or you may want to repeat the blood pressure measurement in 1 to 2 weeks. Yes, you need to repeat it. You cannot diagnose hypertension by a single blood pressure measurement. You cannot diagnose it by a single blood pressure measurement. What does it need? It needs at least 3 measurements on at least 2 separate healthcare visits. 3 measurements on at least 2 separate healthcare visits to diagnose hypertension. Other than that, the patient's blood pressure is just simply elevated due to any reason. You have to verify it by 3 measurements. Or, if in doubt, ambulatory blood pressure monitoring, ABPM, over 12 to 24 hours is the most accurate method to confirm the diagnosis of hypertension. Now, the patient's blood pressure was repeatedly found to be 145/95. This is hypertension. And he was asymptomatic. No wonder. Hypertension is always asymptomatic. What to do next? Are you going to start treatment? Thiazides, calcium channel blocker, ACE inhibitors, or first advice for lifestyle modification? Whenever you find lifestyle modification in any question, choose it. It's going to be the answer. Whenever you find stop smoking, choose it. It's always going to be the answer. So advice for lifestyle modification, it's always going to be the answer. What lifestyle modification? Which of the following is the most effective lifestyle modification that affects blood pressure? All of them are correct. Exercise, stop smoking, sodium restriction, weight loss. But which one has the highest effect, the highest beneficial effect on the blood pressure? Weight loss. The highest beneficial effect comes from weight loss. Treating hypertension. Now, the latest recommendations, the recommendations of the JNC 8. Your blood pressure goal should be less than 140/90. This is the treatment goal for all patients, all hypertensive patients. Your goal in treating them is keeping their blood pressure less than 140/90. But for elderly patients, more than 60 years, you allow it up to 150. So we try to keep it less than 150/90. What medications do we have? We have 3 major classes of medications to start with to treat hypertension. You can start with either of them. Thiazide diuretics, calcium channel blockers, or ACE inhibitors. And you will always see ACE inhibitors / ARBs. What's this ARBs? ACE inhibitors are angiotensin converting enzyme inhibitors. You prevent the synthesis of angiotensin. ARBs is angiotensin receptor blockers. You block the receptors of angiotensin. Both of them will have the same effects, but not the same side effects. There is a side effect caused by ACE inhibitors that is not caused by ARBs, which is irritating cough. So if the patient cannot tolerate ACE inhibitors because of that irritating cough, it does not occur in every patient. But if the patient has this irritating cough with ACE inhibitors, you can very easily switch the patient to ARBs and it's going to have the same beneficial effect. So 3 classes to start with either of them in managing hypertension: thiazide diuretics, calcium channel blockers, or ACE inhibitors. Of course, whenever you have chronic kidney disease, any renal affection, your drug of choice is going to be ACE inhibitors. ACE inhibitors are kidney protective, very protective for the kidney. ACE inhibitors, whenever there is the any renal impairment. Any renal impairment, your choice is going to be ACE inhibitors. But they noticed that ACE inhibitors are not working very efficiently in the general black population. So in general black population, we prefer to start with thiazide diuretics or calcium channel blockers. This does not mean that you cannot use ACE inhibitors in the general black population. Of course you can use it, especially if the patient had renal impairment. But usually general black population, they respond more to thiazide diuretics and calcium channel blockers. Other than that, general non-black population, you can use any one of the three medications: thiazide diuretics, calcium channel blockers, or ACE inhibitors. When are you going to use beta blockers? When are you going to use beta blockers? If there is a compelling indication. What's the meaning of compelling indication? Simply, it means hypertension plus something. Hypertension and heart failure, beta blockers. Hypertension and post-MI, beta blockers. Hypertension and high-risk coronary disease, beta blockers. Hypertension and arrhythmias, atrial fibrillation, beta blockers. Hypertension and migraine, beta blockers. Hypertension and thyrotoxicosis, beta blockers. So we do not start with beta blockers in managing hypertension except when we have a compelling indications, another indication together with hypertension, and we're going to use beta blockers for that. The blood pressure is the product of the cardiac output and the systemic vascular resistance. Anything that increases cardiac output, anything that increases heart rate or contractility will increase the cardiac output, can increase the blood pressure. Anything that increases the systemic vascular resistance, and this is the most important factor, will increase the blood pressure. So to control the blood pressure by medications, the full list of antihypertensives are A, B, C, D, and E. A, ACE inhibitors or ARBs, B, beta blockers, C, calcium channel blockers, D, diuretics, E, else. What else? I can use alpha blockers, minipress, prazosin. They will dilate the arterioles. I can use direct vasodilators as hydralazine. I can use centrally acting alpha-2 agonists as clonidine. I can use renin inhibitors as Tecturna. And ganglion blockers are no longer used, but I just put it here to complete the list. Okay, some side effects of some antihypertensives. Thiazides, what do you think they cause? Yes, you're correct. Thiazides can result in hypercalcemia and hyperuricemia. If the patient has gout, don't give thiazide diuretics. Don't give thiazide diuretics to patients with gout. Beta blockers, what side effects could they cause? Yes, bronchospasm, especially the non-cardioselective beta blockers. Beta blockers narrow the bronchi. They narrow the bronchi, bronchospasm. Calcium channel blockers, very, very potent antihypertensives, very commonly used medications for hypertension, but we always forget a common side effect of calcium channel blockers, which is constipation. Calcium channel blockers can cause constipation, and of course don't forget ACE inhibitors, dry irritating cough, but not in every patient.